ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Climate change is often associated with wildfires, with heat waves, with droughts, with floods, but it is also changing the way some infectious diseases are spreading in Europe. Mosquitoes are spreading to new regions, and ticks are becoming more active during longer periods in the year. Also, extreme weather events can increase the risk for food and water-borne diseases. So, what does this mean for people living in Europe? I'm your host, Andrea, recording from the European Centre for Disease Prevention and Control in Stockholm, Sweden. And I'm here today with two experts, Dr. Aleksandra Kaźmierczak, who is an expert in climate change and human health at the European Environment Agency, and Dr. Celine Gossner, who is an emerging and vector-borne diseases expert at ECDC, and also the deputy head of unit for One Health-related diseases. Aleksandra, Celine, welcome to ECDC On Air.
Hi, thank you for having us today.
Thank you.
Aleksandra, when people hear climate change, they think about heat waves, they think about rainfall, droughts, but they don't connect it with health impacts. Can you please tell us a little bit how climate change is impacting health in Europe today?
Heat is indeed the biggest killer that is associated with climate change. We estimate that 95% of deaths that occur due to extreme weather events are actually due to heat. So it rightly takes the first place in people's minds. But like you're saying, climate change affects health in so many other ways. And if we think, for example, about the other extreme events, flooding is not only causing deaths and injuries, but also carries the risk of water-borne diseases. It also affects mental health, and the mental health is also affected by wildfires. So if you think about the numbers of people who are directly impacted by floods, probably you need to multiply it by a factor of 10, 100 or even more to assess the scale of the mental health implications that are being suffered. Another thing is that those events, they do not affect everyone in the same way. And it's usually the people who are already disadvantaged through their age, through their health, through their income that are affected the most, because they are either the most vulnerable, it means that they are the most affected because of who they are and how they are, or because they live in places that are the most exposed to climate events.
I was going through the European Environment Agency outputs, and I saw also a little bit about asthma and a little bit of respiratory diseases linked to climate change. Can you explain a little bit about that?
Yes, of course. There are several links there. I think one of them is linked to wildfires, which are causing a high amount of air pollution. And that's actually a much bigger health implication compared to the direct burns or injuries. And there are implications for respiratory health there. What we also see with climate change is the extension of the pollen season for many trees and also changes in the pollen season. The pollen count can also be affected, and that also means that people who are allergic might be developing asthma symptoms, or their normal allergic symptoms might be exacerbated by the higher pollen counts.
One thing that often surprises people is how interconnected climate change and health are. Can you tell us a little bit why climate change impacts health?
Climate change has direct impacts on human health. We just talked about heat waves or flooding, how they can directly make people suffer or lose their lives. But what we also see is that the climate risks might combine with other types of changes or risks. So, for example, climate might be affecting the ecosystems that surround us, and that might be increasing the risk of vector-borne diseases, for example. What we can also see is then impacts on the infrastructure that we are using. Our buildings are affected by heat and also by, for example, extreme weather events. Then flooding can make the buildings that we use damp and uninhabitable. And through that, we can also experience health impacts. So the combination of the climate risks with environmental degradation, with the way our infrastructure is, but also how the society is changing. So we see the demographic change, we see the increasing prevalence of many chronic diseases, and that's where then health risks actually are occurring at the intersection of the climate risks and the other changes that we see in Europe.
Celine, is there a need to be concerned or to be better prepared for an increase in infectious diseases in Europe because of climate change?
Yes, we need to be prepared and attentive to these changes. Climate change does not create new infectious disease, but it does create more favorable conditions for some of them to spread. Warmer temperature, milder winters, and more extreme weather events can all influence transmission. And this is particularly relevant for vector-borne diseases, but also for food and waterborne diseases.
Would it be accurate to say that the overall geography of infectious diseases in Europe is changing because of climate change?
Yes, I think this is accurate, although the mechanisms are not the same for all diseases. For some, such as dengue and chikungunya, climate change is helping the vectors, like the Asian tiger mosquito, that is also called Aedes albopictus, to establish in more parts of Europe. Over the past decade, it has spread further north, and it is now established in 16 European countries. If we compare with 12 years ago, the same mosquito was established in 8 European countries. For other diseases, such as West Nile virus infection or tick-borne encephalitis, the issue is less about the vector moving geographically and more about climatic conditions becoming more favorable for transmission. So indeed, climate change is changing the geography of infectious disease risk, but not always in the same way.
With that in mind, which infectious diseases are of concern as Europe continues to warm?
And the main concerns are climate-sensitive infection, where temperature, rainfall, or environmental condition can influence transmission or exposure. So this includes mosquito-borne diseases, such as dengue, chikungunya, and West Nile virus infection, as well as tick-borne diseases, such as Lyme borreliosis and tick-borne encephalitis. So these diseases are particularly relevant to follow in the context of climate change because warmer temperature can affect, for instance, the survival, the activity, and the dispersion of the mosquitoes and the ticks, and the length of the transmission season. We are also watching water-related infection, and we can take the example of vibriosis. We see an increase in sea surface temperature that favors the growth of Vibrio bacterial in coastal and brackish water. And the result is an increase in likelihood of exposure for people. We also follow well-known food and waterborne diseases, including salmonellosis and campylobacteriosis, because heat, flooding, and change in water quality can create conditions that favor the exposure and the transmission. So it's not one single disease that is of concern, but a broader group of infection where climate change can affect where, when, and how easily they spread.
Aleksandra, when we talk about climate change, we see it as a future thing, as something that is not happening right now, maybe something that will affect future generations, our children, our grandchildren. But that is not the case, right? What do we see today?
We see the risks to human health already happening. And what we also see is that actually then climatic changes, the changes in temperature, in rainfall, they are exceeding the expectations of the models that were created 20 years ago. So let me tell you a little anecdote. When I worked in the UK and I started working on climate adaptation about 17 years ago, we worked with the climatic projections for the 2020s. But those models are already obsolete. We actually have gone much further in terms of the changes in temperature that those models were actually predicting. So we see the changes already happening here and now. And I don't know what the weather was like in Stockholm a couple of weeks ago, but most of Central and Western Europe was absolutely boiling. We had this very early heat wave that wouldn't be considered possible without climate change happening. So yes, it is already happening here and now.
Celine, is there anything that worries infectious disease experts in general?
So what worries infectious disease experts is not only that some risk may increase, but that they may become harder to anticipate and manage. So climate change can alter the timing, the location, and intensity of transmission. And this change may not always be gradual or predictable. So the solution is to invest in preparedness, making sure that surveillance, early warning, laboratory capacity, vector control, and more generally, public health response are ready to detect and respond to the changing risk, even when there is a lot of uncertainty about exactly how this pattern will evolve.
Now let's talk a little bit about how prepared Europe is to face the challenges that climate change brings in infectious diseases, but also in health in general. Aleksandra, can you tell us a little bit about the European Observatory on Climate Change and Health? What do you do and what are the priorities?
The European Climate and Health Observatory was set up 5 years ago, and it's an initiative of the European Commission. It's co-managed by the EEA and engages many of the European agencies, including ECDC, but also the Food Safety Authority, European Agency on Occupational Health and Safety, Eurofound, and so on, and many other partners from UN agencies and professional societies, as well as research networks. The European Climate and Health Observatory was set up with an aim to improve the state of knowledge on climate change and health. And that's what we do with our partner organizations. We develop new knowledge, we collate the available knowledge in order to support the informed decision-making on climate change and health. We have several priorities, and one of them is enabling the users to see how the climate change impacts on health are changing, and monitoring the progress we collectively make in being more resilient to those changes. Another big part of our activities is linked to capacity building, to making sure that the knowledge we actually collect is being passed on to the decision makers at the European level, at the national level, also at the subnational level, those working in public health, those working in adaptation planning, to support their decisions and to make sure that they are well informed.
And from ECDC's perspective, how is Europe preparing for climate-sensitive diseases?
Preparedness means supporting countries with the information and the tool they need to act. So this includes monitoring disease trend, assessing emerging risk, sharing surveillance data, producing guidance, and working with countries and partners to strengthen the prevention and the response to climate-sensitive infectious diseases.
From everything that we have been discussing today, both with Aleksandra and with Celine, it sounds like there is a lot in place in terms of structures, of public health resources. But of course, making sure that people are protected is not only the responsibility of public health authorities or ministries of health or governments in general, but there are actions that individuals can take to protect themselves, right? And climate change can feel overwhelming, but there's something that each one of us can do in many situations. What practical actions can individuals take, Celine?
There are simple things that people can do to reduce their risk. For example, they can protect themselves against mosquitoes or tick bites by using repellent, wearing appropriate clothing, and checking for ticks after being outdoors. They can also follow food and water safety advice, especially during hot weather or after flooding. And they can check travel health recommendations before going abroad. So while climate change is a big issue, some practical steps at the individual level can still make a real difference.
Okay, now we heard what individuals can do to protect themselves and to protect their loved ones. But I imagine that there are other sectors also that have an impact in terms of actions. Can you tell us a little bit about that, Aleksandra?
What we see in Europe in terms of climate change adaptation is that all of the national governments have a national adaptation policy in place. Many of them actually have put adaptation in legislation, and it's a legislative requirement to adapt. But adaptation to climate change actually happens at the local level, at the subnational level, and it's done local authorities or provinces who can take a lot of action to protect individuals. And most of this action actually happens outside of the health sector. So if you think, for example, about spatial planning, and making sure that people are not building houses in flood risk areas. That immediately reduces the exposure of people to one of the climate risks. Or if you think about urban design and built environment and making sure that the cities we live in are designed in a way that doesn't make them hotter than they need to be. And the buildings that we are spending so much of our time in are actually healthy buildings. They are cool. They do not expose us to the risks of, Legionella in the air conditioning ducts and so on.
If listeners remember just one thing from today's episode, what should it be? Celine, what did you say?
If there's one thing to remember, it's that climate change is already affecting infectious disease risk in Europe, but we are not powerless. So if we act early, strengthen preparedness, and work together across sector, we can reduce the risk and better protect the health of people in Europe.
Aleksandra.
My message would be that climate change is real. Don't listen to the disinformation. It's real. It's already happening, but you are not powerless. You can do a lot to protect yourself, as Celine mentioned before. You can also vote for those who can protect you and make sure that that action is being taken.
Thank you, Celine, and thank you, Aleksandra, for being here today.
Thank you, Andrea.
Thank you. It was a pleasure.
That's all for today's episode. A big thank you to Aleksandra and to Celine for helping us understand the impact of climate change on infectious diseases and on human health. If you want to learn more about these topics, visit eea.europa.eu and ecdc.europa.eu. And if you enjoyed this episode, don't forget to subscribe, like, or leave us a review. Thank you for watching today, and until next time, stay safe and stay informed.